it's scary. I can't deny that there are days when I question why am I still here, because it is exhausting. But you wake up the next day with hope that you will make a difference in somebody's life. You can help somebody, and you can be there for someone when, especially the fact that the family and the patients are separated. You stand in for the family, you stand in for the loved one. My name is Mashita binti Mansur. I am a nurse clinician in Medical ICU, Changi General Hospital. When the news first came out about this virus, we were already starting to prepare to make sure that we are equipped to handle the situation. Trainings, we are preparing equipments, contingency plans, in case if it drags. So these have been considered, even at the very initial part. So then, your cap, cover. Okay. We don't have a shield, right?
We don't have shield.
Okay, so, yeah. And you clip it in. But it's still, the fear is still there, because you kind of like have those memories that just came flushing back of your very sick patients during the previous situations. Your heart breaks for them and their family member, the helplessness of the situation. We are also somebody's wife, somebody's husband, somebody's mother, father, children, somebody's niece, you know. So we do carry that same fear that anybody else has, but this is the role that we choose. You just can't walk away from that. So this is the mannequin that you will be using to resuscitate. So the patient actually has COVID-19 positive. So Nurul is going to run through with you all the... I remembered seeing a picture, a drawing of a firefighter giving a baton, and the baton has the word hope on it, to a nurse. At that time when COVID first started, I think Australia just got over the bushfire. They passed the baton of hope to the healthcare providers, and that is such a huge significance, so humbling. I felt it's an honor to be seen that it is a fight. So whenever we have an activation or a resuscitation and we wear our PPE, we wear our N95, our cap, our gown, it's like a swimming pool, you know, inside. Especially the N95, sometimes when you open up, it's like, whoa. And you wear it the whole day. So it's not about the number of patients that you attended to, it's about the whole process, the whole changes in the situation. As a nurse or healthcare provider, you are supposed to be helping, healing, caring, you know. But it's so difficult to show it when you are like covered up like a popia, you know, like your mask and your cap and everything. And how do you resonate that I'm here for you? It's a lot of trying to fulfill our roles behind that facade, that mask and that gown and that gloves, and I think that was a very big challenge. This is Dr. Maharaj. We received calls on our duty phone, and then after that we will push the trolley out to the ward. Alright, let's go. When we were told that the measures are being eased, and we like, really? You have this mixed emotions. Hey, I went through a lot, you know. And is it really okay now? Among some of my extended circle, people will just go like, yay, it's over, you know, and you don't want to burst the bubble because everybody is so happy, but you want to tell them that you still need to have social responsibility, you still need to be careful because it's not really over. Unless you go through it or you walk the path we walk, you wouldn't really understand the apprehensiveness that we have. I'm glad that we actually do see the light at the end of the tunnel and we're walking towards it. But I'm still careful. We are all still careful because we know that it's just so unpredictable. How am I feeling now? Tired. I guess not because of only work, but because everything around you was affected. Your children, your family, your work, and you felt like you're being stretched at every side. It's like, during that 2 years, you are like the adrenaline and you are giving everything. You put your tiredness, your exhaustion aside, and you just go. And now you're starting to feel the effect of that kind of energy that you've been putting in, and then I think you're just feeling it now. But you still have to go on. You don't sit down and take a breather anymore. You still continue to be a nurse or a doctor or a healthcare provider. You continue. I think it's not only the healthcare providers, it's everybody. We just have to have consideration for people knowing that their life has changed during these 2.5 years. And everybody goes through it differently, and everybody's adapting differently, and everybody's healing differently. And I think we just need to be a bit more considerate, a bit more kind, and think about the people around us. They may look normal, they may look okay, but we don't know what they're going through.